neck region has small bones of vertebrae. They are called as vertebrae. And there are 7 small bones in our neck region. Yes. And in between, so the vertebral body, which is there, what you touch from behind is this spinous process that you are seeing here. This is what, when you touch your head, neck behind is what you feel. And ahead you have your vertebral bodies. Yeah. In between the vertebral bodies, if you see this green color mark, they are the intervertebral discs. Okay, now these intervertebral discs are like cushions. They take over all the load that you put on the spine in the initial phases. And there are 7 small vertebrae. And what work they have to do? They have to take the load of the head and they have to take the load of the arms. Yes, so this is what the function of the, this is the strain that comes on the vertebral bodies, the head. So head position, shoulder position. These two are very, very important when it comes to the load coming on the neck region. And we are going to do a lot of exercises with your head and with your shoulders. Yes, so this is about the anatomy of the spine. We'll just go quickly with the theory so that we can do more practicals. Now we will just see what are the problems that start happening when your cervical spine starts getting affected. So initially when you keep the head in a straight position, like prolong looking at the screen, this is what normally happens. Abhi, many people, they are like this. Yeah, we tend to have a forward head posture. Also in a stagnant way, like we continuously look at the screen, we are reading, right? So all this starts putting weight, stress on the intervertebral discs that we showed you. Once these discs start getting strained, their water content starts getting loosened up and they start, the disc starts degenerating. Yes, early degenerative changes start happening and this causes the bones to come little closer to each other and then the bones start rubbing on each other. Yeah. When this starts happening, this is the initial phase of cervical spondylitis. Yes. Current research says that age group of 25 to 30 have started showing signals of cervical spondylitis. This is one thing. Another thing, what happens is when you hold the head in one constant position, and there is obviously work stress, which is going to be there. There is, mind stress, physical stress, both are coming on the body. And the first muscle which gets affected in our body is the trapezius muscle. So when you get scared, okay, or when you're mentally working out something, yeah, the first muscle which takes all this load is this muscle, which this guy is touching. Yeah, that is the trapezius muscle. And this trapezius tends to go into contraction. This is called as trapezitis. Yeah? And it starts giving you aches and pains here. And if the nerves start getting pressed there, then you'll get tingling sensations all over the hand. So this is one problem, very, very common. Another common problem is headaches. Now headaches are of various varieties. Today we are going to talk about the cervicogenic headache. So in cervicogenic headache, what happens is, we will just show you. So we spoke about this. This is trapezitis, where this portion is affected. And then your upper cervical. So we saw 7 vertebrae. Out of the 7 vertebrae, the first 2 vertebrae, which are topmost, yeah, when they get affected, the muscles over there get tight. They start restricting the movement of the neck. So which movement they restrict? They restrict your neck rotations. Okay, and they become tight. Yeah. So when they become tight, there are nerves which pass from the upper cervical region which supply your head. And you start getting a headache. Yeah. When the lower vertebrae get tight, yeah, from there the nerves supply your hands. So you start getting the tingling and all. Somebody mentioned in the beginning carpal tunnel syndrome. Many a times carpal tunnel syndrome means the tingling which you're getting in the hands is not coming from the wrist, but it is coming from the neck because the lower cervical nerves are getting compressed. Yeah. So this is what happens because of stiffness. Other common problem which happens is disc bulges. Now, every time when you're sitting like this, your neck goes into a slight flexion position and that causes the discs which we saw to bulge out behind. Okay, many of you all must be riding bikes also. So when you are prolonged, or you must be riding a 4-wheeler, either of the two. So when you are sitting in a prolonged position, the disc is already back. And then when you go on a speed breaker or a jerk, so then that disc bulges out. So that is a slip disc which happens in the cervical region. Once the disc is out, it starts compressing the nerves, severe pain, and all these things happen. Now, these things may not be happening at the moment for y'all, but it is already the process. The initiation process of the problem has started. It's just that one episode and the problem shows up fully. Okay, so little bit of neck pain, little bit of headache would be a complaint of most individuals. Yes, we all have. Anybody has headaches, neck pain? Who all have? No, everybody is fit. Okay, most of you all have. Good. Yes. Yeah, so everyone has this problem, and today we are going to do the solution for it. Yeah, and there's one more problem which is associated with the neck is vertigo. So there are signals which go from the neck to the ear to the brain, and they help us in maintaining our balance. Yeah, so vertigo is yet another problem which happens because of neck region, neck issues and middle ear issues. Yeah, but today we are not going to go into the details of vertigo, though we'll be teaching you a couple of exercises to prevent that from happening. Okay, so